Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Today we're going to be talking about some serious infectious diseases that have been in the news. And joining us for this important discussion is board-certified infectious disease specialist, Dr. John Brooks. In this first segment, we're going to be talking all about the measles. Dr. Brooks, welcome back to Today's
Hi, Barb.
Health.
Great to see you again.
Well, I never thought I'd be talking about measles with you. I got to tell you I didn't, but here we are.
Yep.
So what is measles?
Well, it's interesting because the reason you would have thought you wouldn't talk about measles, in the year 2000, the United States declared us that we were free of measles. So we had thought we had done a good job because we've been vaccinating for so many years, since 1963, for the measles, so we really controlled that. But measles is a viral infection, and so young people are most prone to it. So measles is a respiratory infection, so you get it by breathing it in. And then what happens is that after a little bit of time, you start to get a lovely rash, and we can see that on the monitor. So it's a viral infection that causes severe illness in certain people. So measles, when we think about people like us that are a little older, didn't think maybe it was all that serious. The problem is measles is a very serious illness for many children. So what happens with measles, if it is serious, they have infection of the brain, and the brain swells, they get encephalitis, and they die. So that is one of the biggest problems with measles, is that yes, it causes a rash, and the rash is resolving, but it is the infection of the brain that causes death that is the biggest problem that we have with measles.
Well, let's start then with the symptoms. When might a parent think, oh, gee, I wonder if my child has the measles?
So again, as of right now, it's difficult because measles is not common in the United States, so people haven't seen it for so many years. So we are kind of stuck of looking at, some pictures and trying to remember what we saw those years ago. Some of us that have seen measles can look and say, well, measles it's an acute viral infection. So kids are going to act kind of almost like the flu. So they're going to have a fever, they're going to have a runny nose, and that's a big part of measles. They get a lot of runny nose. They get conjunctivitis, so they get a red eye or red eyes, and then they start to get a rash. So measles is interesting because 4 days before you have any symptoms, you're shedding the virus and are infected to other people. So then the whole time you have the rash and symptoms, you're infectious. And as your symptoms get better, you're still infectious for about 4 days. So it's a very unique virus because most of the time we think like the common cold. You got about a day before you got it, and when your symptoms are gone, you're done, you're no longer infectious. Most viral infections kind of act like that. While you're sick, you're infectious, maybe a little time before, but you don't have 4 days before and 4 days after, which is why measles is one of the most contagious of the viruses that we have. It's pretty fascinating in that when we look at, let's say the common cold, if I have a cold and you're sitting there, you have about maybe 20% chance to get it because you've got to contact me because the virus requires direct contact, or you have to breathe what I've put out. Well, within about 3 or 4 feet, my droplets that I exhale will fall to the ground. You're not going to breathe them in. Now, measles is very different because the virus goes in and actually goes down in the air droplets and it floats in the air. So the air around me when I have measles is contaminated, and it stays that way for up to 4 hours. So if I'm in a closed room and I have measles, that room now has measles virus floating in it. If I go in the room and I'm not immune, I can get the measles.
Wow, that's pretty scary, and I can see why we were vaccinated. I want to talk to you a little bit more about the risks related to measles. You talked about infectious to the brain. Are there other risks related to measles?
So it is a respiratory infection, so there can be pneumonia-like infection. But again, it's the central nervous system part of the infection that's greatest. So when people, and usually children, get measles, again, they're going to get like a respiratory infection. They're going to have a little bit of a cough. They get a runny nose, that's coryza, and that's a real common part of it in conjunctivitis. So that's what we see, and then the rash. The rash is a pretty significant rash, as we saw in the picture. It's a very widespread rash, kind of starts and spreads, becomes all over the place by the time it's there. And what we've said a couple of times is that, of course, this is an illness mostly in children. Now, adults are not naturally not able to get it. It's just most of us have either been vaccinated or had the infection when we were young, and we get lifelong immunity. So it usually is of children, which is why the picture shows a child, and they're the ones who are most prone, and because they're developing and their brains are developing, the virus likes to go to the brain, and that's why it causes such severe infection there.
Well, other than children, who are the other adults that are most at risk to getting measles?
So people who are immunocompromised, so people who are on cancer chemotherapy, people whose immune systems have been lowered. In this world right now, we have many special medicines for people that have like rheumatoid arthritis, so that we can help them get through their bad diseases, but it lowers the immune system, so they become more prone to viral infections. People that have HIV and AIDS are also very prone to any of the viral infections.
What is the risk to women who are pregnant?
So unlike rubella, which is another one of the viruses, when we think about the vaccine, the MMR, measles, mumps, rubella, now rubella is really a major problem for pregnant women because it can cause damage to the fetus, a very bad syndrome where it damages the fetus, and also loss of pregnancy can happen from rubella. For measles, it routinely doesn't do those particular problems.
How do you treat measles?
Well, there's no specific treatment.
Virus.
It is a virus, but what we can say is, being healthcare workers, let's say you were never been immune for some particular reason, you get exposed to measles, we can give you the measles vaccine. If we give it within 3 days of exposure to the measles, it acts like a treatment. There is also a very specific antibody treatment. It's called an immunoglobulin. So let's say somebody is really immunocompromised or something very wrong with them and they unexpectedly get exposed to measles. We can actually give them immunity from other people to try to get them through the infection. But there's no specific drug therapy that we can utilize for measles.
How do you prevent the measles?
Well, vaccine is really the name of the game. That is really the most important way to prevent this significant viral infection.
And what are the myths around vaccination that have caused people to make decisions not to vaccinate their children?
You know, it's really fascinating because that's a point of history. If we go back to the late 2000s, 2008, at that point in time there was a European physician from England, United Kingdom, and he published a paper that linked MMR to autism. Dr. Wakefield was his name, and what ended up happening is shortly thereafter he lost his medical license because they proved that he faked all the data. He did a sham. It was just terrible because he made many people believe that maybe this vaccine can cause autism. Since then, it has been proven without a doubt in any scientific mind that the MMR vaccine does not cause autism. And he has been, again, he lost his license because he lied, and everything that he published has been retracted. So the concerns for autism has really been a big part of this. And the other thing that sometimes I sit and think about from the ID part of my world is that so many people have benefited so greatly from the MMR vaccine, the measles, mumps, rubella, because they are not ill. They've never been ill, especially young adults that are having children now. So they've benefited greatly from having the vaccine, that they're healthy enough to have children. And now people, because they're worried about autism, which is not proven to occur from MMR, they're not vaccinating their children, so they're putting them at risk for these serious viral infections. And it just seems to be for me, there's a break in logic of why you wouldn't want to give your children the wonderful health benefits that you have benefited from yourself.
Now you had a slide that shows us when you vaccinate people and how it impacts the health of the community.
Yes.
Can you talk us through that?
Some people call it about community immunity or herd immunity. We like to say community because we're not Buffalo, right?
Right.
So when we talk about community immunity, what's important is that if we, all the people around us, are not immune to an infection and it comes to us, it quickly will go all through us. I'll transmit it to you, who transmits it to the people you live with, who then goes on to the people they work with, and quickly it goes through a lot of people. Now, if most of us are immune to a particular infection and the infection comes in, what happens then is that although that person may have the infection, they can't transmit it to other people. And other people who might be able to get it, it doesn't have a chance to get to them because all the healthy people surrounding the people that are at risk for infection don't bring it to them.
Okay.
So that's called the community immunity. So when most people are immune, then we don't pass the infections from one to another. And for measles, that's important because we've just talked about the fact that it's so highly infectious, it's so easy to transmit it to other people. So what we've looked at and what they've studied is that if we don't have community immunity, or most of us at 94%, so 94 out of 100 people have to be immune to measles to not transmit it to other people.
So the big takeaway on measles as we close this segment is?
Vaccinate.
Be vaccinated. And Can you be vaccinated as an adult?
Yes, so if you have no proof of immunity to measles, mumps, or rubella, as an adult, you are absolutely able to get the vaccine. There's no age cutoff. People who have a bad immune system, there's some issues with that sometimes, and that's always talk with the doctor personally. But in general, adults, if they're not immune, they can get the vaccine also.
All right, we're going to take a break, then we're going to talk a little bit about shingles.